Every 40 seconds, someone in the US experiences a stroke. You've probably heard of the FAST method: face drooping, arm weakness, speech difficulty, and time to call for help. It's simple. It's life-saving. But here's the catch. Not all strokes look like this. Some signs are so subtle, they're often dismissed until it's too late. Today, we'll uncover 5 silent symptoms that don't appear in FAST but can be just as urgent. And here's the kicker. One of them is so commonly misdiagnosed that even doctors sometimes miss it. I'll reveal that one in a few minutes. Quick disclaimer, this video is for educational purposes only. It's not medical advice. Always consult a qualified health professional for concerns. Section 1. The thunderclap headache. Our first hidden sign is sometimes called a thunderclap headache. This isn't your usual stress headache or even a migraine. It's sudden, it's severe, and it peaks in intensity in under a minute. Why does this matter? Because in rare cases, this can be linked to bleeding inside the brain. It's not about scaring you. It's about recognizing when a headache feels different, sudden, and extreme. Have you ever ignored a symptom because you thought it'll just go away? The answer? Most of us have. But with a potential stroke, waiting can make recovery harder or impossible. But headaches aren't the only whispering warning sign. The next one hides in plain sight, and most people mistake it for simple eye strain. Section 2. Sudden vision problems. Imagine this. You're reading or walking, and suddenly it's like a curtain drops over one eye. Or the world doubles. You see 2 of everything. Sometimes your side vision just disappears, and you start bumping into things. This can happen when a stroke interrupts blood flow to the brain's vision processing areas. The key word is sudden. Vision that changes drastically within seconds is a red flag. If your vision suddenly went blurry for 10 minutes and then returned to normal, would you seek help or shrug it off? The answer? Most people shrug it off, but that's the danger. Temporary or not, sudden vision loss can be the body's way of shouting for help. But vision isn't the only sense that gets disrupted. What if the stroke targets something far more personal, your personality itself? Section 3. Sudden confusion or personality change. Strokes don't just affect muscles. They can change how we think, act, and even who we appear to be. One moment, someone is fine. The next, they're disoriented, unable to follow a conversation, or acting in ways that feel completely out of character, withdrawn, agitated, or confused. This can happen when a stroke impacts the brain's frontal or temporal lobes. And here's the tough part. It's often dismissed as stress, aging, or even just a bad day. If a loved one started acting completely unlike themselves, how long would it take before you knew something was wrong? The answer? Sometimes only minutes. Which is why sudden changes should never be ignored. Now, if that feels unsettling, the next sign is even trickier, because it's often confused with something as harmless as standing up too quickly. Section 4. Sudden dizziness or loss of coordination. This is the most misdiagnosed stroke symptom, and the one I told you to watch for. We're talking about sudden severe dizziness or a total loss of coordination. It's not just feeling lightheaded. It's vertigo so strong the whole room spins. Or ataxia, where walking straight suddenly feels impossible. This often signals a stroke in the cerebellum, the brain's balance center. But because it can look like an ear infection or dehydration, it's dismissed far too often. If you couldn't stand or walk properly out of nowhere, would your first thought be stroke or something less serious? The answer, almost everyone assumes it's something minor. And that delay is where the danger lies. But what if your body gave you a test run, a short rehearsal before a bigger event? That's where our fifth and final symptom comes in. Section 5. The mini-stroke, TAATEA, or transient ischemic attack, is often called a mini-stroke. Here's why it's dangerous. Symptoms can mirror a full stroke: slurred speech, vision changes, weakness, but then they vanish in minutes. And because the person feels fine, is fine, they don't seek help. But a TIA is not harmless. It's the body's final warning. About 1/3 of people who have a TIA experience a major stroke later, often within just 48 hours. If your body gave you one warning shot before a life-changing event, would you listen? The answer: that's exactly what a TIA is. A warning you can't afford to ignore. Let's recap the 5 silent stroke signs beyond FAST. 1. Sudden thunderclap headache. 2. Abrupt vision loss or double vision. 3. Sudden confusion or personality change. 4. Severe dizziness or loss of coordination. 5. Temporary symptoms of a TIA. The FAST method is powerful, but these additional signs expand your toolkit. Acting fast doesn't just save lives, it saves quality of life. If this video helped you, please share it, because you never know whose life this knowledge might save. And in the comments, tell me, have you or someone you love ever experienced a sudden symptom that was brushed off at first? Your story could raise awareness for someone else. Don't forget to like and subscribe for more evidence-based health insights. Stay informed, stay safe, and remember, awareness is action.